COVID-19 infections within the wider Singapore population are low, according to initial findings from 3 new studies when the samples were taken in the last 2 weeks of March. However, the preliminary research also shows infection rates among close contacts and household members of confirmed cases have been underestimated. The studies are being conducted to gauge the prevalence of coronavirus and will help determine the effectiveness of control measures. More than 2,000 people have undergone serological tests, which can detect if the virus has been contracted even after recovery. Now, the studies focused not just on targeted groups like frontline healthcare workers and close contacts of confirmed 19 cases, but also the general community. And so far, none of the tests on nearly 1,100 healthcare workers has returned a positive result. For close contacts within a household, the research shows a more worrying trend. Previous testing picked up just half the number of people infected. The other half were undetected because they did not report symptoms. For the general community, however, researchers say infection rates are low. The studies will be expanded to include more healthcare sectors such as polyclinics and larger samples from the general community. And that will more accurately reflect the state of infection among the population.
The relevance of this study is, I would say, several-fold. The first thing is that it tells us that our surveillance system and method of diagnosing cases using swabs of tests for looking for the virus is not substantially under-diagnosing cases. Secondly, it tells us that by and large, as of the middle of March, the epidemic in Singapore was largely under control. It also tells us that going forwards, the vast majority, 99.99% of our population remains susceptible to this virus, and we need to then have that vigilance going forwards.